Here's a USMLE style question focused on the top Swan Ganz catheter, pulmonary artery catheter. USMLE question on Swan Ganz catheter, pulmonary artery catheter. A 62-year-old man with a history of chronic heart failure is admitted to the intensive care unit ICU for management of acute decompensated heart failure. Despite diuretics and vasodilator therapy, his blood pressure remains low and his central venous pressure, CVP, is elevated. Given the need for further hemodynamic assessment, a Swan Ganz catheter is placed to monitor pulmonary artery pressures and cardiac output. Question: which of the following is the primary purpose of using a Swan Ganz catheter in this patient? Option A, to measure systemic vascular resistance, SVR. Option B, to assess right atrial pressure, RAP. Option C, to estimate left ventricular end diastolic pressure, LVEDP. Option D, to monitor pulmonary capillary wedge pressure, PCWP. Option E, to calculate ejection fraction. The correct answer is option D, to monitor pulmonary capillary wedge pressure, PCWP. Explanation: the Swan Ganz catheter, also known as the pulmonary artery catheter, is primarily used in critically ill patients to monitor hemodynamic parameters, particularly pulmonary capillary wedge pressure, PCWP, which is an indirect measure of left ventricular end diastolic pressure, LVDP. Elevated PCWP is often seen in left-sided heart failure and can be used to guide treatment in acute decompensated heart failure. Systemic vascular resistance, SVR, can be estimated using the arterial pressure and cardiac output, but it is not the primary measurement of the Swan Ganz catheter. Right atrial pressure is measured directly through the catheter and reflects right heart function, but the main purpose in heart failure management is often the PCWP. Left ventricular end diastolic pressure, LVEDP, is closely related to PCWP, but the Swan Ganz catheter doesn't directly measure LVEDP. Instead, it estimates it using the PCWP. Ejection fraction, EF, is typically assessed with echocardiography or nuclear imaging, not through a Swan Ganz catheter. In this patient, monitoring PCWP provides valuable information about left ventricular preload, helping guide therapy and manage fluid status in acute heart failure. Thank you for listening.